The 2025 American Heart Association Guidelines for Cardiopulmonary Resuscitation and Emergency Cardiovascular Care have introduced a systems-based recommendation regarding safety huddles, which could significantly impact hospital culture and patient outcomes. Safety huddles are defined as short, structured team discussions aimed at improving situational awareness among hospital staff and facilitating early identification of patient deterioration. The primary objective is to prevent in-hospital cardiac arrests by ensuring all staff members are aware of high-risk patients and the proactive measures that can be taken to stabilize them. For the first time, the American Heart Association has formally recommended the implementation of safety huddles as part of in-hospital cardiac arrest prevention strategies. According to the 2025 guidelines, these huddles enhance team communication and shared vigilance for high-risk hospitalized patients, help mitigate patient deterioration before arrest occurs, and can effectively reduce cardiac arrest rates. This recommendation carries a class of recommendation 2A, indicating it is considered reasonable and beneficial, supported by moderate-quality non-randomized evidence at level B and R. The recommendation is substantiated by evidence from real-world outcomes. The American Heart Association references two multicenter observational quality improvement projects where teams implemented a cardiac arrest prevention bundle that included safety huddles for high-risk patients. In these studies, pediatric cardiac and general intensive care units demonstrated notable reductions in in-hospital cardiac arrest rates following the implementation of regular safety huddles. Additional research reinforces these findings, as structured safety huddles in pediatric ICUs resulted in a 52% decrease in CPR events per 1,000 patient days, along with lower mortality rates while huddles lasted less than 1 minute per patient. These outcomes demonstrate how consistent interprofessional communication can positively influence patient safety. The safety huddle recommendation is positioned within the Systems Saving Lives section of the 2025 American Heart Association Guidelines, which emphasizes integrated hospital systems designed to promote prevention, preparedness, and quality improvement across every link in the chain of survival. In practice, safety huddles complement existing tools such as early warning systems and rapid response or medical emergency teams. The approach combines human judgment with clinical data to ensure subtle signs of deterioration do not go unnoticed. This method aligns with global resuscitation practices, as the European Resuscitation Council 2025 guidelines endorse similar daily team huddles, recommending that resuscitation team members meet once or twice per shift to clarify roles, identify at-risk patients, and prepare proactively for emergencies. While technology, including automated early warning systems, plays a significant role in identifying physiological risk, the American Heart Association update underscores that preventing cardiac arrest also relies on shared human judgment. Safety huddles formalize this process by transforming intuitive concerns into concise, high-yield collaboration. This approach helps hospital teams focus on the right patients at the appropriate time before a crisis develops. For hospitals seeking to reduce in-hospital cardiac arrests, adopting safety huddles represents a cultural shift toward enhanced teamwork and situational awareness rather than mere compliance. Effective implementation involves integrating short, unit-based huddles into existing shift change or rounds workflows, focusing discussions on risk stratification, clear escalation routes, and anticipated care steps, and balancing data utilization with clinical experience. In 2025, prevention represents the initial link in the American Heart Association's unified chain of survival, with safety huddles serving as the connection between data, teamwork, and improved patient outcomes.